We good? Everybody ready? All right. Hello, everybody. Good afternoon. Thank you for being here as we continue these briefings to the public related to the COVID-19 pandemic. Just to really reflect before we get into data on kind of where we've been. It's been over 3 weeks now since we've had a positive case. It's been well over a month since we've been planning and preparing for the pandemic. We've learned and pivoted around best information, new data, and certainly will continue to do that. But we're very lucky that early on, with the help of all of our hospital partners, our public health department, our emergency management team, as a community, we came together and formulated a plan and a strategy to test before we had positives. We were testing before we had a positive case for over a week before then. We had a mobile triage testing site up and running before we had a positive. We're one of the only communities that could say that. What was the strategy and the plan behind that? We knew getting into this process at some point, our medical infrastructure would be in peril, meaning if we got too many positive cases at once, how do we hold up? How do our emergency rooms hold up so that they can treat everybody who has an emergency? How will they hold up with ICU beds, with PPE, with equipments? So how do you keep that infrastructure intact? We had to identify positives and quarantine and do this quickly. So throughout that process, we've done that. At times, the testing lags have been longer than others, but overall, we've had a community plan that has worked and worked well so that we are really at this point in time today to try to do something next. So our strategy has always been test, identify, quarantine, starve. And so let's keep that in mind as we go through today's briefing on how important the starving part of this process is for this community. Current stats, 397 cases, up from 377 cases yesterday. 20 additional cases since yesterday. Sadly, we have lost another member of our community. We had our 6th fatality, a woman in her 70s with underlying medical conditions. I am very, very sorry to her family and to everyone else who's lost their life to this disease in our community and throughout our country. This virus, this disease is a killer, and our community and our community at large needs to start recognizing that more and take this very, very seriously. 38 individuals are in the hospital. That's up 9 since yesterday. Like we said, this disease and this virus, when you get it, it impacts you differently. You can be feeling good one day, the next day you could need help breathing. This is the reality. We need everyone to take this seriously. When you look at people who are now in the ICU, we now have 20 of our neighbors in ICU fighting for their lives. 14% of our active cases are now in the hospital, and 7.4% of our ICU cases, people fighting for their lives, are now in ICU beds. These are beyond sobering stats. A reminder about our hospitals. We're reporting daily on the impact we have in Onondaga County with our hospitals and our numbers. Other communities are certainly using this infrastructure. We have our graph over here that shows our central and northern New York communities and some of our southern tier communities that are all utilizing our hospital infrastructure. When you look at these cases as a region, we have over 1,100 cases at this point as a region that are utilizing our medical infrastructure. That may mean if you live in a community in the North Country or you live in Cayuga County, you go to Auburn Hospital. When Auburn Hospital becomes inundated, then those folks come to hospitals in Syracuse. We know that. We've prepared for this. When we're looking at our models that we've talked about over the last few days and these algorithms where they go, we take into consideration the counties directly surrounding Onondaga County, but the reality is we're servicing so many more than that. We now have 119 people who have recovered and have been released from mandatory isolation. So our current active case number is 272 cases. Again, that's up 15 from yesterday. So we had 5 people recover since yesterday. We have 2 curves. We always have our positive curve, which is kind of a linear curve right now of positive cases. And now from that, we kind of have this active case curve. We need to flatten both curves. 42 individuals in our total positive number of 397 are contact cases. We know that really right now between 12 and 13% of our total cases are going to come from contacts. That's part of the challenge. It's part of our plea to the community that we have to starve this. You have to change your behavior, because if you become positive with this through some contact, we know that from our contacts, another 12% of cases will end up being positive, will grow from that. And those numbers are holding pretty consistent. The contact case, what's a contact case? Someone in your family or your household. So we are seeing cases that are directly linked to social behavior, social gatherings that don't need to happen. For every really 10 cases like that, at least 1 new case comes because somebody in your house is going to get sick. It's not necessary. Out of our cases, 208 are female, 189 are male. 12 are under 19 years of age, 86 in their 20s, 61 in their 30s, 54 in their 40s, 75 in their 50s, 61 in their 60s, 32 in their 70s, 13 in their 80s, and 3 in their 90s. 25% are under 30, 40% are under 40, 54% are under 50, 73% are under 60, 27% are over 60. Breakdown by municipality, and we have some new graphs to look at this over to my left. The city of Syracuse, 146 cases. Town of Clay, 43 cases. Town of DeWitt, 29 cases. Town of Camillus, 25 cases. Town of Salina, 24 cases. Town of Cicero, 23. Town of Manlius, 21. Town of Onondaga, 20. Town of Pompey, 15. Town of Geddes, 14. Town of Lysander, 11. Town of Skaneateles, 9. Town of Van Buren, 4. Lafayette, 3. Marcellus, 3. Atisco, 3. Tully, 2. Fabius, 1. Spafford, 1. What does this tell us? The virus is everywhere. North, south, east, and west. In these new charts we have, we highlighted by caseload per 10,000 what towns are doing better than others. Certainly, some of the towns are in a position where by population, they're not doing good. And then we have the city of Syracuse broken down. Certainly, based off of sections of the city, we see more positive cases in certain parts. So when we look at the town of Pompey, not a very populated town, 15 cases, that 15 cases represents the highest percentage per 10,000 in the county. Town of DeWitt started out very low. Over the last few weeks, the town of DeWitt has creeped up and really represents the second largest per capita, per population number in the county. So looking at the city of Syracuse, I'm looking at my old city council district, 13207 zip code. A lot of cases. Then when you look at the city of Syracuse, look at Eastwood, Eastwood's doing very well. So as this goes on, we get to look at data and we get to really assess this, and then that helps us with our education and information campaigns when we see outlying communities. But I think it's important that this is so real at this point, and this is so critical at this point. This is everywhere, and it's impacting neighborhoods that and towns. It's not the virus does not care if you're an affluent community, if you're a working class community, or a rural community. The virus needs a host. Okay. After the positive test, our health department will contact you to check on your health, gather information about any direct contacts. You should also be hearing from your primary care doctor, who knows you best. This is how we know who goes into quarantine based off direct exposure. Working in the same building does not mean you've had direct exposure. Shopping at a store when somebody tested positive who works there does not mean you've had direct exposure. In our investigation, if we believe you've had direct exposure, you're going to hear from us. Anyone who's been tested must stay in a quarantine until you get your results. This was an executive order we put into place very early. It's worked very well, helping us with our early testing to create quarantines so that folks who have a high probability of being positive, again, if you're tested, you're sick with something, you shouldn't be out and about passing on whatever you may be sick with. But certainly this has helped us. It is the law, just to remind everybody. As we've shared previously, if there's a gap in the investigation with the health department, we're going to reach out to the public. We're going to educate you on what the gap is, where, if you went to that business, where you may have had exposure or not had exposure, so that you can look after your symptoms directly and talk to your doctor. We are in a community that has community spread. I'm encouraging, imploring all of our residents to check your symptoms daily. Take your temperature daily. Take your temperature twice a day. It doesn't take a lot of time, and certainly please be very cognizant of your health. It's for your own good and for your family and for your community at large is good. Positive cases, again, we had 5 people recover. There's a process for releasing from isolation, and as we have more cases, more people recovering, more quarantines, this is a process. This weighs in on our medical infrastructure. It's not just the hospitals, it's our own infrastructure with our health department weighing in on this. Demand has been high over the last 2 weeks, so we've utilized technology to help in this process. In order to expedite the process, we have an online password-protected application where you can go and input your information if you're a positive case. And please put that in there. That helps us monitor, and it helps us get you through the process to get you out of mandatory isolation when you're healed. Remind you, the official release isn't when you put something in the online portal and you think you've met the guidelines. It's when our health department tells you you are released and you then are no longer under a mandatory isolation. That does not mean you get to go out and behave in a way that is against your health and the public's health. We are asking everybody, obviously, to be under a voluntary situation for the next 2 weeks where we change our behavior. And so that goes for everybody. Social distancing, we talked about our enhanced social distancing policies. Madison County today came out very smart. They're going to have the same policies we have. Why is that important? Per capita, they've had an increase as well. Madison County is our neighboring county, one of them. A lot of people come into each other's counties, working, shopping, and whatnot. So I want to thank Chairman Becker for his leadership and his Board of Supervisors for being such strong partners. We talked about, I believe, the metric via cell phone data. Each day it grades us. I would say the good news early in this process is that yesterday our data via cell phone, mobility, and unnecessary travel was at a C-. 1 day after we start talking about our voluntary stay-in-place order, we've increased our grade to a B-. So thank you. We need to do better still, but this is critical that we take this seriously. So I think we talk about this on Sunday, we talk about this on Monday, we start doing it, and look what happens. It works. So thank you for that to the community. We need to do better now. We need to be an A. Social distancing efforts don't have county lines as well. I've talked to partners in various counties around us, asking them to take this seriously and to join me in our efforts. To give you an idea, some of these other counties, I know many people are watching this from other counties as well, but I want to give you an idea about this. Yesterday, Cayuga County, D-, Cortland, D, Madison was a D, Oswego a D. Oneida actually was beating us yesterday at a B-. So we tied Oneida today. So we really need to, as a region, take this seriously. How we get back to normal is we aren't with failing grades or average grades. We have excellent, exceptional grades in this social distancing. This helps make us, and if we have excellent grades here, the data will start to reflect that. Okay, we're going to talk about preventable cases. What were some of the things we're seeing? For the most part, our cases have no affiliation with traveling at this point in this process. Early on, we did. Most cases are now due to a community spread. The data we're seeing shows the increases in cases are mainly from preventable scenarios. Going to work when you're sick. Not practicing proper social distancing both at work and outside of work. And a preventable scenario that we talked about from the beginning that unfortunately is becoming a reality in all of our data that we're seeing is visiting mom and dad or some of our seniors. Mom and dad are getting lonely. Our seniors are getting lonely. We have many, many cases now where people are visiting their loved ones with good intentions and they're getting them sick. We can't do it. And specifically this weekend, it's a holy weekend for various religions. We need to stay home. We need to use technology, whether it's the phone, whether it's Skype, Zoom, FaceTime, whatever it is. We do not need to put mom and dad at risk because we're getting families together. We see it. We see the data shows it. Positive cases are showing it. We know that if anybody has compromised medical conditions and they get this thing, it's a killer. Our data shows it's a killer. We need to stay home this weekend and spend time. I'm going to be celebrating Easter with my immediate family. That's what we need everybody to do. And I don't want to be the bearer of bad news, but that's what we need you to do. When we look at other things, there's been various social type recreational gatherings where we've had positive cases. We don't implement policies because we just want to hear ourselves talk at the podium. We implement them because we're seeing data that merits decision making. So please keep that in mind. Voluntary shelter in place. Our positives keep on going up. We saw yesterday demands with the testing. We had 2 days of demand go down, but yesterday we saw demands go up related to testing. And so it's inconclusive what trend we're on. The only thing we know we can do is we can starve the virus and we can social distance. Right now, again, our pending tests, around 400 pending tests out there right now that we know out of that 400, 8% of those are going to at least be positive. So that means we have at least 28 more positive cases that we have to go find and quarantine. So to continue to get off that linear curve, we have to social distance. We have to. That's what we can do as a community, and it looks like we're responding a little bit. Tomorrow we'll have our new grade. Hopefully we'll be up to a B. Looking at the voluntary shelter in place, certainly it starts today. I know many people already started implementing it through the 21st. We believe by hunkering down for 2 weeks, this will help. And this will help drive the data. And this will give our health department time to do thorough investigations, quarantine, identify as we continue to test people with symptoms. And the less contact we have with people, the less people will be getting sick overall, and that will drive good results for the community. Masks. Seen a lot of people in masks out in the community. This is good. This is a CDC recommendation. It's our recommendation that you cover your face when you're in public. It's smart. Other communities, other countries have done it. It's worked for them. It should work for us. So please do that. Certainly the Plasma Project with Upstate and Red Cross, the research part of this, that's something that is very important. that we continue. This is a virus that when we beat this virus, and we will, we don't know the behavior of this virus, whether it's going to end up being seasonal or not. We need to do everything we can to prepare ourselves for the next go around when we're done fighting this. Being part of the Upstate and Red Cross Project helps us get there. A couple phone numbers again. We touch on these on a daily basis, but they're important. Upstate Triage Hotline, 315-464-3979. That is a hotline for folks to get testing, to get screened for testing if you don't have insurance, or at times you may be referred to that by your primary care provider if they are lacking in PPE or test kits. At our Triage testing site, we have test kits and PPE there, so that may be why you use that line. Seniors, healthcare worker, and adult nutrition hotline. If you're in need of a meal and or help with groceries and or toiletries, you have a need, you're not signed up for regular Meals on Wheels. This is a hotline where we are filling gaps for our residents. 315-218-1987. If you're needing daycare, you're an essential employee, you have a daycare situation, we don't want mom or dad or grandma or grandpa filling in that gap as much as grandma and grandpa want to see the grandkids. We get it. This is not a good scenario. If you're an essential worker, you're out, you're contacting people, you come home, you have contact with your kids. We don't need anything potentially spreading on to grandma or grandpa. So what do? We have free daycare for you. No excuses. 315-446-1220. Again, 315-446-1220. Child Care Solutions will help organize that for you. Vera House support and information line. We know Vera House, there's no excuse for abuse. If there's, right now, a lot of people are spending a lot of time together under very stressful situations. If you need help from Vera House, 315-468-3260. Donations of PPE, 315-435-2525. We just gave, our emergency management team just gave Upstate some PPE. Our hospitals run, they go out, they try to buy their own. They run low. If you have PPE, emergency medical equipment, please call us, donate it to us. We constantly are trying to buy it as well. Very competitive. Any donations we get are going to go back into nursing homes and hospitals. Will go to good use. Our veterans, we're still open for our veterans, 315-435-3219. And again, any folks who need help related to the ongoing mental health challenges that this pandemic is causing for us, please contact 211. We have mental health professionals there that can be very helpful, and they're ready to help you through this process. Questions?
This job, could you have ever imagined standing at a podium day after day, and on many of those announcing that somebody in our community passed away?
No. I've been in government since I was elected and started serving in 2006, and we've seen real challenges, the Great Recession, and we've seen other governmental challenges. You deal with budgets, you deal with spikes in crime at times, and there's never been anything like this. And so you have various pressures and various anxiety levels that are spread out to every family, to every economic industry. You have certain economic segments of the economy under complete shutdown. It's unheard of. Our country's gone through tragedies before. We talked about 9/11 at one point in this process. 9/11 was a wake-up call for those of us who are in our early 20s as to how dangerous the world can be. But even with 9/11 and all the tragedy with that and the pain with that, when you look at the broad-reaching, how it impacted, it didn't impact every industry. It didn't lead to shutdowns. It didn't lead to isolations for this period of time. So this is really uncharted territory, Andrew.
With
Brian,
medicine,
it looks like there's pretty distinct differences in neighborhoods in the rate of infection. The east side is like 4 to 5 times less the rate of, the valley and the southwest
Yeah.
Have the health folks come up with an explanation for that?
The numbers, Tim, when you look at the city numbers compared to population percentage, are a little bit higher. You know, the city's about a third of the county population. I think their numbers as far as cases go is about 36%, so a little bit higher. So when you look at the city numbers overall, not as concerning, but certainly when we break down by households, you are starting to see crystal clear patterns. And the patterns are that in neighborhoods you'll see geomap, and you'll see things where that there can be no other explanation when one street has a couple cases other than the fact that people are gathering and they're not taking this seriously. I don't believe in chance when you see it across the county. I don't know, we haven't been able to dive in enough really by zip code to figure out what the underlying issue is in some of this. Look at my old district over there in 13207, diverse district, but we're trying to get more data related to what's the breakdown of Caucasian versus minority. I can tell you out of our 6 deaths, they've all been Caucasian. So we don't know. We're starting to really dive into that analysis and look at what else we can do to educate certain populations. But a lot of these cases, what we're seeing over the past 7 days, are preventable community spread cases.
So part of it may be you're hypothesizing that people are just getting the message better in some areas than in others.
Yeah. Taking it more seriously, maybe. Yeah. Next question.
With Madison County jumping on board with the voluntary shelter in place, are you hoping other counties in the region will start doing that as well? Have you been in contact with any of them, and any of them seem interested in joining on?
Yeah, I talked to various leaders in other counties today, too, around us. The algorithm from Upstate that I showed yesterday, actually, it's not standing up. It's right down there. Justin, I don't know how it's right down there. Good question, right? I'm just teasing Justin. This algorithm right here. Okay, so these 2 curves, that brownish, reddish curve, and that yellow curve, all these curves represent about 650,000 people. So we look at this as a region, right? So that's not all of these counties in here representing this curve, but needless to say, it's you can say Madison, Cayuga, and Oswego, and Cortland are probably in that number. So we're talking about the need to get to 50% social distancing to get this curve, to get to this yellow line. And if we get, and I'll do it like this, right? Put it up like this, okay? If we get to that yellow line, if we do better than 50%, we have a new curve, which probably means get to normal faster. If you hit the yellow line, I think by getting to that yellow line, you get to have the conversation about what life looks like. How do we restart everything? If you get to this brown line, or some people see red. I see brown, but some people see red. If you get to that, you get a situation where your hospitals are in huge trouble, and we're opening up Manley Fieldhouse. So even though it's not the 2 big bad lines, see these 2 big bad lines right here? Boom and boom. This is disaster, okay? These 2 lines. This line, we're opening up a surge site for ICU beds. And so you can see why we're doing what we're doing and why we're asking people to take this seriously, because we have an opportunity. We've had an opportunity this whole time, and we've been kind of, what way are we going? We've been ahead of this. And now I always use sports analogies. We are on the bubble right now, what line we're going to, okay? We always like to be on the good side of that bubble. And so to do that, we have to get to 50% social distancing. And if we want to even do better, then we're going to do better, and we're going to have our own curve, and we're going to be in a position where we're asking the state and federal government, look at us, let's start reopening this, let's start reopening that. Kids can go to school, they can resume sports programs. This is where we want to be as a community.
So this isn't just a community by community thing. You mentioned that people travel between them, so
Yeah.
this is all everyone kind of needs to unite.
Yeah, this is a regional problem, and so as a region, we're talking about this after this regional planning for this type of issue again. Where social distancing, these are very smart people at Upstate. There's other models, and where they predict where we'll be with positive cases each week, right? On April 10th, they're predicting we'll have 500 positive cases. I'd like to be a little bit less than that, and I think we have a shot at being that if we can starve the virus. So there's various models. Our job as a community is to social distance to make sure they're all wrong to the betterment of our community. And again, if they go the wrong way, and that's why it's asking for perspective here from people. People are. When are we going to look at some of these numbers and realize taking a couple days off of golf is not a big sacrifice when we've had 6 people die, 5 people die in the last week. We have 15% of our cases are in the hospital. I mean, are you kidding me? Let's put things in perspective as a community. I'm still getting emails from people telling me how they're so safe on the golf course. I don't care right now about you missing a day or two on the links over the next 2 weeks. I care about the people in the hospital and how I make sure that's not you or your neighbor or your grandma or your grandpa or your parent. That's what I care about. So we're being very transparent. We need everybody's help and buy-in. And for us to have the success we have to avoid long-term pain, let's take 2 weeks and do the right thing and stay home. And if we're going to go out shopping, let's go out shopping on the days we've talked about. That will get us to 50%. And if we do even better than that, things will be in a position where we can open up business again and we can start minimizing economic pain in our community.
It's only 3:30, but any indication on the first day of the voluntary shelter in place, if there's any examples of how it's working on the first day?
Look at, I know I really look at the first day being Monday because we announced it Sunday and we went up a full grade. It took us a week to go down a grade. So now we're back up to a B-. We started, when people were very scared, we were at a B. Right after that first week, people were very scared. They didn't know. A lot of people needed testing. Our testing went down. People got more comfortable, not because we had less tests, but because there's less demand. They start socializing more. They start spreading a little bit more. Now our testing demand's up a little bit. Not where it was, but it's up a little bit. We got to get to the point where the demand for testing is 50 tests a day, 100 tests a day, not 200, 250 a day. And if we do that, we'll have more recoveries, and then we will new cases, and both curves will flatten, and they'll go the right direction. But our only way to fight back is to stay away from each other.
It's probably the nicest day we've had in a while, which is not a benefit to social distancing. Any examples today of anyone doing something they shouldn't, and what would you tell people as they head into their evening?
I'm not sure, Andrew. I'm sure they're out there. I haven't been focused in on the bad behavior yet today. I'm sure I'll have emails where people are sending me pictures like we always do. But I think people got to really get it now. A big 2 weeks for this community to spread this thing out, starve this virus, this disease. We'll talk till we're blue in the face about it, because that's part of our role in this process, is to be a communicator and then to make decisions based off of data and information. But there are people in the community that just don't get it yet, and I don't know what else needs to happen to get it. And we do have some people in the community that reached out to me specific to golf. I had golf courses reaching out to me on the quiet. They don't want their members knowing this, saying thank you for doing what you did. Our employees were nervous. We didn't know, we're in a bad spot to try to regulate this. So we had a lot of golf professionals, a lot of golfers saying thank you. We've had others just thinking in this short-term window, please let us go play golf. It's going to be nice out today. everybody like you is thinking the same thing. You get hundreds of people on a golf course, you're going to have hundreds of hosts there to spread this, which means hundreds of quarantines, which means pressure on our hospitals and on our health department, and it means this goes on longer. So eventually, when everybody else catches up to our decisions, that your courses are shut down for months, not for 2 weeks.
You mentioned the importance of testing. Are they still using the same protocol for determining who gets a test? You have to have a fever of 100.
Yeah, I think they're a little bit more liberal on the fever of 100, Tim. They're looking at other symptoms, but there's certainly symptoms there. We're on the liberal side of testing at this point. We've had internal questions about, is there guidance we can give, and what would that look like to make it more liberal? Usually the health professionals like to wait for the CDC to make that call. We've had, if testing capacity becomes where I can go buy 25,000 tests, then we can make decisions about testing non-essential employees in a whole economic cluster, and then making the case that we just tested all those workers, let them go back to work. If we had that type of capacity, we could then do things outside of what the medical realm determines. We just don't have that capacity.
Is the capacity still day-to-day and week-to-week?
I would say it's more week-to-week at this point. It's not day-to-day. But it's not to the point, we get emails saying, do your job, go test everybody. Okay. Go make me 467,000 tests and I'll buy them right now. And I'll shut everything down for 3 days and everybody gets tested. The reality is there's no one selling 467,000 tests. That is the best way to get going, is having all the testing you need. You can identify everybody sick and put them in a quarantine, in isolation, get them help, and then you can put everybody else in a quarantine, and then literally in 2 weeks you're in the clear, and you can send a lot of people off to work, right? So we don't have the ability to buy all those tests, or else we would.
The governor invoked quicker testing as a way to open the economy sooner. You said you've been very open. You've already changed providers. You said you'd be open to changing providers again if they prove that there's a quick test. I guess I'm wondering if there's any hints that that's coming anytime soon. Are you in contact with anyone who's claiming this could happen eventually? Any research on quicker tests being available to you sooner rather than later?
So there's quicker tests and there's the quantity of tests, right? So quicker tests helps us a little bit regarding catching people who are sick faster and quarantining faster, which is valuable. But as part of the debate, the quantity of tests has to be there for us to have confidence that we have everybody in the community who's sick in a quarantine and getting them help so that everybody else can go to work, right? So 2 issues. The testing overall is getting quicker. We would still like real-time results, but it's better than where it was when we started. The quantity is not, if there is a manufacturer out there of test kits and they want to sell 467,000 tests tomorrow, my number is 435-3516, 315 area code, okay? No one's going to call me with that offer right there because nobody can sell that many at once.
You might get other calls.
Yeah, I get lots of them.
Brian, why did the test turnaround get a little slower? You mentioned it went to up to 72 hours.
I think it's all more robust testing across the country now. There's more cases across the whole country than there was even 2 weeks ago when we were doing it. There's more testing being done in New York State than there was. So we had a period of time where it was very quick, a little bit backed up, not tremendously backed up, but that's really what's happening. Is you're more part of the increase in cases is that they were there. You're identifying them all now, in other parts of the country and state.
One of the things that the governor came down with was closing construction sites, except for exemptions.
Yeah.
Today there was work being done on the amphitheater and some tree work along the West Shore Trail. What kind of exemption did that get?
We're the government, and so we have if we have a project where it's deemed that it can lead to a public safety. You're talking about two parts of a park system that a lot of people go through and go by. So that's the exemption falls under public safety and the government right there.
Today, the governor said that he thinks we're reaching the apex of hospitalizations. Is the county experiencing that?
Yeah, I think the context that you get each day is, I think the governor goes on in the morning. We give our briefing at 3 once we have all of our data for Onondaga County, and then I think the federal government talks, I think, in the evening, right? So the context is based off of those three scenarios. The governor is really talking about what he's seeing in New York City and Long Island, and ours is different. We were testing, and before we had cases, we were a little bit ahead of the curve, learning from New York City. So one mindset could be we're behind them. We're 2 weeks behind them when it comes to impact. So you could suggest that in 2 weeks would be our apex, or the other line of thinking is because we were testing early, and because we're identifying and quarantining early, that our trajectory is different from theirs totally. And so I don't know the answer. I'm hoping ours is unique and different. And so how do we get to unique and different? We do what we're asking to with the shelter and stay voluntary order we have out.
I have a semi-deep data question that I'm hoping I can explain what I'm looking to know. You said 9 new hospitalizations since yesterday.
Yeah.
Is that literal people checking into a hospital, or in some cases are people already in the hospital, but because their results aren't back until a moment, then they're added to the hospitalizations from COVID-19?
My understanding is new patients is 9 new sick people coming into the hospital that need help. So again, that number is 38 are in the hospital now out of 272 active cases, and 20 people are on essentially ventilators, right? We talk a lot about ventilators these days, so 20 people are on ventilators right now, meaning they need help to breathe, okay? So I need the community's help to realize how serious this is.
How's the hospital capacity?
Right now, we're okay. Certainly, we're not in the position we were a week ago. We're more strained. And certainly, if we don't get to 50% social distancing, if you're somewhere between the brown and the yellow curve, it's going to be tough. If we go to the brown curve, we're going to have problems. We're going to be opening up Manley Fieldhouse. So I think the way to avoid all that is let's do better than 50%, and let's make our own curve and write our own story as a community. And at the end of this, it can be the Onondaga County and Central New York success story in this pandemic. But I can't write that story. The residents of this community need to write that story.
Do you know the data that the grading's based off of? Is that pulled from the past 24 hours? Is it? Do you know how that data is collected?
Our data?
For the grading.
Oh, yeah, that's every 24 hours right here. Oh, that's okay. It's right over there. Yeah. Yeah, so that changes on a daily basis. So that's all based off cell phone tracking data.
We still don't have any positive cases under the age of 20?
No, we have 12 under 19.
We do.
19 and under.
Okay.
Yeah.
A lot of numbers. I'm sorry.
Yep.
I'm wondering, I don't know how young those numbers go. I guess I'm
we
more
have 2
asking.
cases under 10, which are contact cases. One is a contact case. One is a case where someone wanted to have a play date.
Okay. So my question is then, do we know how children are responding? Is it as contagious to children? I know there were, projections early on, but locally, are we seeing that
I
children are
believe,
immune to
Andrew, out of our hospitalizations, the only demographic we've had the entire process with having no one in the hospital was under 19 and under. So out of every demographic we break down, there's been at least one person in each decade, 20s, 30s, 40s, 50s, 60s, 70s, 80s, and 90s, that has been hospitalized. Under 19 and under, there has not been anyone hospitalized yet. So I don't know what that means as far as how well they do, and I'll never really know. But the we've not had someone hospitalized. But out of our under 19 and under, most of them are closer to 19. There's 2 under 10, and that they were none of them were related to any school issues. Schools were all shut down when all these people, after all these people got the virus, positive virus.
Any children have gotten it from their parents?
One contact case. Yep.
Something you were worried about a few weeks ago was SU students coming back and returning to off-campus housing. How has that population responded?
I haven't heard a lot of complaints about them, and I'm sure, knowing the neighborhood they live in and knowing my previous career on the city council, I know how active that neighborhood is. So if they were behaving badly, I'm assuming, you know what happens when you assume sometimes, right? That we would be hearing about them. So I think we're doing okay. I know the university's been a great partner and working to stay in touch with their off-campus students. And I think certainly we got through that spring break process of people coming back into the community. Were they carrying anything? That's all behind us now. So, but overall, I think we're doing okay there.
Ryan, was the woman whose death you mentioned today, was she in the hospital before she died?
I don't know the answer to that. I know she's in her 70s with underlying medical issues was the information I have. I don't know if she was, if she just got in the hospital or if she didn't. I'm not sure, Tim.
I guess I was wondering whether the folks who have died have all died despite, the best efforts of our hospitals and having equipment available.
I don't know the answer to that. Other questions?
Just one more on parks. Folks have noticed that some of the parking lots are getting blocked off.
Yeah.
Now. That's part of the effort to limit the number of people.
Yeah, so we've said we're going to cut the debt. We've basically shut down programming at parks, playgrounds at parks. Essentially, parks are closed, but we're allowing people to come in and exercise, with the idea being that we're going to use our park rangers to control where you can park. So we're shutting down lots. I heard some people were parking outside in the village of Liverpool to go then into the park. But if we get to a position where it's just too many people in the parks, we're going to have a tough decision to make. I think for the most part, we're not running into a social distancing situation in the parks at this point. But we've shown throughout this process we will make tough decisions at every step of it if we believe the public health is at risk, even if that risk is 1%. If there is any risk to the public health, we will make a tough decision because we're fighting for every one of our residents. Okay? So I'm used to sharing lately these funny emails where everybody's telling me to resign and I should get fired. A couple of those have happened, but the language is so colorful, I don't think people would appreciate it. But I got this interesting one from Dan, and Dan said, "Please share this, Ryan." I said, "Okay, Dan. 6 feet away is better than 6 feet under. There's no I in team, but there's 2 in idiot." So Dan is asking everybody to be part of the team, the social distancing team, and I couldn't agree more, Dan. This is a serious, serious situation. We have an opportunity to get ahead of the curve, flatten our curve, and do the right things, and I can't do it, and I can't regulate it and govern it. I need all of you to help me with that. So thank you.